Allison, it's showing up correctly.
No, we're seeing your presenter mode. So if you click
So
on,
let me
yeah,
swap. Okay.
yeah,
How about
perfect.
next?
Everything looks good.
Okay, great. So this was actually one of my favorite topics because I think it's so fundamental to what it means to be humans, right? This is kind of our chance to not, in my perspective, to not think about, you or myself or those that we care about as patients, but what it means to go through a difficult circumstance and how we kind of navigate that wilderness, right? And just to give a little backdrop, and I'm going to go back. I remember when I first started, and I had like a full head of hair back in those days, and thinking about program building and whatnot. The easiest approach for me, I'm just putting yourself in my shoes, was to start with an exercise program because it was safe, right? There wouldn't be many controversies from the oncologists and surgeons about, well, why are we talking about exercise? Everyone basically believed in the value of exercise. We just need to show our patients in our community how to do it safely, how to progress, and how it can really help our well-being and our survivorship and whatnot. And then from there, I kind of worked on a cognitive rehab program and a yoga program and other kind of basic things. But when I was sitting in my own clinic, right, and sitting with our patients and trying to navigate certain elements of survivorship, there was this existential piece that I kept bumping into over and over again. And that's the part that has no easy pill to fix. And I hope we could talk about just at least on some basic level, right? We're not going to solve the big questions together, but we all, right? I don't think we would be here if we did not suffer at some point in our life, right? That's just fundamental to what it means to be human. I mean, of course, we hope that our suffering is minimized and limited as much as possible, but at some point, everyone is going to experience some element of suffering. And this is how the palliative care docs define it. You're either preoccupied with the past or future. We feel disconnected. We feel like we want to be in control, but it might feel hard to be in control at that time. And we have that need. Or there's this existential vacuum, right? This crisis of meaning. And so how do we walk through this? And as I was thinking through these really, again, fundamental human questions, and by the way, if I would love you to challenge me on any idea that I speak about, because I would love to, reimagine this in other ways. But to me, the basic questions that came up were, number one, what does it mean to be healthy? What does it mean to be resilient? And what does it mean to be fulfilled? Another way of looking at it is, thinking about other existential questions like, who am I? Why am I here, right? These are the religious, spiritual questions that I'm not here to answer. And how am I going to live my life once I understand my own sense of meaning and purpose in the world? Right. We could say that these are not oncology issues, but I would argue that for any reflective person, right, you're gonna engage in these questions at some point when you go through something like a cancer diagnosis. And as I was thinking through this, I was looking back at the history of medicine and how this was viewed at different times. And many of you may know the word medicine comes from the Latin medicina, which means to heal or restore health. Now, this is where I would love your participation. If I asked you, what do you think of when you hear the word medicine? What would you say? I mean, what do most of us think of? Just reflexively, I wouldn't overthink this. When you hear the word medicine, what comes to mind? For most of us, at least.
Drugs.
Drugs. Thank you. So medicines, prescriptions, etc. Anything else? And I would argue that at least for many, we think of a drug, we think of an X-ray, an MRI, a blood test, a surgery, a procedure, a biopsy, right? And these are things that, right, doctors do to us or give to us or prescribe to us, right? And if we view medicine in that way, which I would argue most of us do in our society, then we're in a reactionary state, right? So if somebody, right, orders a CAT scan, if it's if the report is positive, we feel good. If it may not be, and if it says something else, we may not feel as well. If our cholesterol is up, we may feel one way, and it goes down, we feel another way. We're in a reactionary state to what the blood test, the CAT scan, the tumor marker shows. And the challenge, again, in my mind, is when we go back and think about the fundamental questions. What does it mean to be healthy, resilient, fulfilled? Who am I and what's most important to me? I would argue, and I think we could all agree, that there is no medicine that's going to answer these basic fundamental questions of what it means to be human. I mean, I prescribe regularly, not infrequently, antidepressants and anti-anxiety medications, and I think they have a role and they can play some value in our journey. But again, I do not believe that these medicines in isolation will answer these basic questions of our existential experience. And if you disagree, please pause me. And so what I'm here to kind of suggest in a very global sense, and I'd like to talk about a couple strategies and how we could do this, that perhaps true healing in the most holistic way can only be found in the way that we live our lives, by the kind of actions we take on a day-by-day basis, the kind of thoughts we think about on a day-by-day basis, and the way that we take care of ourselves and our family members and our community. Again, much easier said than done. I do believe now, after having worked with my colleagues on developing elements of the GRACE program, that's what I'm here to share with, just a couple elements of that there is an art to this from that we glean from the wisdom of many people over the ages. And in many ways, I kind of just viewed our role as just packaging it in a way that we thought made sense. So there are many elements to this. When we do the program, it's usually 11 or 12 hours. And even then it's relatively brief. I'm thinking I'll maybe spend 30 minutes just to kind of highlight a couple elements. And then we could, talk about what can come next. But first, I would argue that it probably, in many ways, is most instrumental is thinking about a sense of meaning and purpose. And we've all heard this, but the question is really, how do we bring this down to earth? And I like to think sometimes anecdotally, and sometimes anecdotes help us give us a sense of framework, right? I don't know if anybody heard of this gentleman. His name is Mr. Israel Crystal. And he got a fair amount of fame back in 2016 because at the time, he was the oldest male alive in the world. He was 112, which is, of course, a remarkable feat for anyone. But the reason he really got a fair amount of attention was not only was he the oldest male alive, he was also a Holocaust survivor. And so he endured the rigors of the concentration camps. He whittled down to something like 87 pounds. He lost everyone that was close to him. He lost all of his personal belongings. And of course, all the physical and psychological torments that went on. He endured all that and he still made it to 112. Actually, he passed away 1 year later at 113. And of course, at the time when he got this Guinness record, everyone was asking him, of course, this one basic question, right? They all wanted to know, how in the world did you endure all this and still make it to this age? How did you do it? And I'm just pulling out one passage from one interview that at least resonated with me. This is what he said. "I don't know the secret for long life. I believe that everything is determined from above, and we shall never know the reasons why. There have been smarter, stronger, and better looking men than me who are no longer alive. All that is left for us to do is to keep on working as hard as we can and rebuild what is lost. Now, I have no idea how he made it to 112 and later 113. I am sure that luck and maybe genetic factors and who knows, maybe something else in his lifestyle played a role. I have no doubt. But if I had to guess, I believe that that last sentence in this passage may have offered us some clue, right? He said, all that is left for us to do is to keep on working as hard as we can and rebuild. So there are several things that comes across in that passage. One of them is a sense of optimism, which I think is important despite everything that he endured. But he also clearly, in my mind, was conveying that he had a crystallized sense of purpose on what he had to do. But he didn't suffer these losses in vain. And of course, he wasn't the first person to talk about this. I imagine many of you are familiar with Dr. Viktor Frankl. He was a young psychiatrist who was also in the concentration camps. And because he was a psychiatrist, he had a keen way of observing his environment despite everything he was going through. And he also suffered, right? He lost his mother, father, brother, pregnant wife, right? They all perished. He was in Auschwitz, which was among the worst of the worst, reportedly. And he survived. And one of the things he observed and noticed during his time on hell on earth, you could say, I believe, is, maybe he said anecdotally, maybe 1 in 10 people survived the camps. And his argument was that it wasn't just luck. Certainly luck played a role if you were directed to this line or that line. And he wasn't minimizing the role of just random luck that played in one's survival. But his argument was that 1 in 10 seemed to have a meaning or purpose in their suffering. And it was different for each person, whether it was getting back to their art or getting back to science so they can make a difference, or reconnecting with a family member, or for him, remember, he started to work on this book that became later known as Man's Search for Meaning. He actually had the idea that meaning can help us rise above any challenge before the concentration camps. It just happened to be that he was put to the test himself, which is ironic, you can say, because of what he was going through. So he wanted to get back to telling the world his story about how we can rise above by finding a sense of meaning and purpose. And his argument was that 1 in 10, yes, they had luck and some other factors, but they also had some sense of meaning that somehow enabled them to endure. And again, he wrote about this in Man's Search for Meaning. If you haven't read it, it is an amazingly rich and profound book, in my opinion, probably one of the most extraordinary works of psychology in the 20th century. It's only about 120 pages, but it's a profound 120 pages. And one of his fundamental arguments was that Frankl argued that, essentially there are 3 sources for meaning and purpose, and any one of these 3 or its combination can fulfill that basic human need of what it means to be human. And that could be either through our work, which of course could be through acts of volunteer work or community work or other types of service, or our profession, through acts of love and caring for others, or cultivating a sense of courage, particularly during difficult times, right? It's easy to be courageous when everything's safe and easy. It really matters when there are moments of fear and challenge and uncertainty. And when we can tap into courage, that gives us a sense of meaning and purpose, according to Dr. Frankl. So remember, he wrote this book after World War II. I think it was published in English in, 1950 or something. And so his ideas were in many ways empirical, just based on his observations and beliefs. Now, there was this really interesting study that came out more recently, 2016, Dr. Frankel had already passed away, where it was a meta-analysis. So they kind of grouped together 10 smaller studies. But once they grouped them, they had 136,000 individuals in the study. And what was interesting is they knew, based on the research profile that they had on each individual, they knew the health characteristics that we believed were associated with longevity. So we knew who had diabetes, who had heart disease, who was a smoker, who was obese, who wasn't getting any exercise, and on. The things that were already recognized to be important for our longevity. And they factored those comorbidities and whatnot into this statistical equation. And then they did something interesting. Once they factored and weighted that all in, they wanted to compare those individuals that had the most sense of meaning and purpose in their life compared to those that had the least. And of course, as you can see before you, they found that all-cause mortality for any cause was reduced by about 17%. And cardiovascular events, that basically means heart attacks and strokes, also down by 17%. Even again, when they factored in smoking, obesity, diabetes, et cetera, you still saw this difference. And again, in many ways, I feel like this was providing some further validation to what Frankel hypothesized, 80 years earlier. Now, one of the ideas that Frankel comes to in his work, and he kind of beckoned his readers on, was to stop asking this question, what does life expect from me? Oh, excuse me. To ask yourself, what does life expect from me? And to stop asking the question, what do I expect from life? Now, he chose the word life, and others might interpret this to say, what does God expect from me? Or what does the universe, or what is the world, or what is nature? However one chooses to interpret that. That was his demand on his readers, was to stop saying, what do I expect from life? And instead ask the question, what does life expect from me? And I know there's just a simple, kind of transposition of the words, but the implications of our life outlook when we go about our lives asking the question, what does life expect from me versus what do I expect from life? I would say is radically different. You can just imagine, right, the two scenarios and how you see and perceive the world with one outlook versus the other. And we'll come back to this in a second. I think there's another way of kind of visualizing and taking in this kind of basic, profound question that can be exemplified with again, another more recent study that I'd love to just highlight briefly. So this was a study, this actually occurred with the group Steve Pohl at UCLA and his team, where they looked at a group of adults who all reported that they were doing well, like they were happy on the surface. So, when people fill out these kind of quality life questionnaires, they all said that, they're happy and doing well. But the difference was basically half the group was considered to be hedonistic in their outlook, and the other half was considered to be eudaimonic. So hedonistic, right? I think we all know basically what that refers to. That's basically someone who, right, is kind of, interested in pleasurable things, right? So anecdotally, like if I was at a dinner party and I knew the person sitting to my left was very kind of strongly hedonistic, I might assume that they're there for the, the filet mignon and the wine and champagne and the nice, lights and music and whatnot. Now, if I knew the person sitting on my other side had a strongly eudaimonic type of outlook or personality, what does that mean? And eudaimonia originally came from Aristotle, and it essentially refers to this idea of being more virtuous in your living. So kind of more concerned about service or meaning, or purpose, or helping others and that kind of thing. Now, again, this is going to look like gibberish. I'll walk you through this, so please don't get overwhelmed with this. But so this study basically looked at adults who on the surface reported that they had high levels of well-being. But part of the group was eudaimonic, part of the group was hedonistic in their outlook. And they wanted to see if their inner biology was different. And this is what I'd like to show you. So part A of this figure looks at something you see here as the CTRA gene. So what in the world is that? So CTRA gene is the gene that's associated with the fight or flight response, with adversity, right? So when we're living a life of more chronic adversity for weeks or months or longer, our bodies upregulate the CTRA gene. Right? We all know, I think, that we inherit our genes from mom and dad, but which genes are turned on or turned off to a great degree may be regulated by our life experiences. And the CTRA gene is one of those genes that how we live our life. So when we're experiencing more chronic adversity, our body upregulates CTRA gene. So what did they notice? The hedonistic group had upregulated CTRA gene expression. The eudaimonic group downregulated CTRA gene expression. And part B, if you could follow me there, the hedonistic group had more of these inflammatory compounds and lower levels of antibodies, right, which are important for our immune system. And I think for inflammation, I think we all recognize that chronic inflammation generally not viewed as being healthy for our health in the long run. And the eudaimonic group is reversed, right? You can see lower levels of inflammation, much higher levels of antibodies. Now, when I saw this study, of course, this big light bulb went off in my head because, right, this was published, about a decade ago, relatively recently. And I couldn't help but think about Frankl. So remember, Frankl wrote about this, decades prior. And his argument was, this is kind of what he described is, there were, for example, infectious illnesses that would kind of wipe out many members of the concentration camps, right? That was one of the biggest causes of death, was starvation, infectious illnesses, etc. And so when I saw that, and remember, his argument was those that had a meaning and purpose in their life seemed to somehow survive the rigors of life camp. And when I saw this maybe provided some biological credibility to what he said. Again, and you could imagine the people that have a sense of meaning and purpose in life were the eudaimonic group, right? And they had higher levels of antibodies. Is that why they were able to survive, the typhus outbreaks? For me, it's just a guess, but I think it's personally a reasonable one. And so in my mind, right, the hedonistic group, being very kind of generic about this, might go around life saying, what do I expect from life? And by the way, I think that works fine. I think that works fine if that is our outlook, except when things are not going well. Right? When we have a really difficult situation in front of us, in my experience, that's when the challenges are most kind of obvious. When we go, because nobody expects cancer or any significant negative effect happening in our life. We don't want these things to happen. But the individual that may be more eudaimonic, which in my mind is more likely to be the person to ask the question, what does life or God or universe, however you choose to ask that question, what does life expect from me? Yes, it's still going to be a challenge, but I think we're going to engage in that challenge with a different perspective. Now, this may seem a little bit depressing at first because you may say, well, I'm just born to be, you know, hedonistic. That's just my personality, or I'm just, you know, we're just born that way. And so I want to challenge that point with one other follow-up study, and then maybe we could just kind of wrap up with a couple of concluding ideas. So this was really interesting. It was again, Steve Cole and his, the group where they took 160 women from Southern California, and they measured their CTRA gene, as I'm about to describe, and they randomized them to 4 different groups. I'll describe those groups in a minute, but just to give you a sense, it was completely random which group they were assigned to, and I'll describe what each group was asked to do. But basically, the first point I want to make about this study is this was not a 3-year-long duration of an intervention. It was basically just 5 weeks. So I'm going to come back to that point in a minute, but it was just 5 weeks. Now, that's not a lifetime, right? Where they had some baseline measures, including, again, the CTRA gene that I just referred to, the intervention period, and then again, they had their post-intervention measures. So what were these groups about? So the one group was asked to basically perform acts of kindness to others, right? And just as an example, I'm not going to read all the details, but for example, they were asked, during the period, for example, tomorrow, you were to perform 3 nice things for others. And these were just meant to be routine, basic things. So one person, for example, said, I made it my significant other a favorite meal, or somebody else, took the mail in for the neighbor, or whatever it may be. So something, some kind of act of kindness. The kindness to the world group, they were told, for example, tomorrow you're to perform 3 nice things to improve the world. So one person, for example, donated money to Plant Discovery Day, as an example. And this went on, again, for 5 weeks. The third group was asked to kind of perform some self-care, right? Kindness to yourself. So tomorrow you were to perform 3 acts of kindness for yourself. So one person, went to the beach. Another person left work early and had some Thai coffee, something along those lines. And this kind of continued for those 5 weeks. And they had a control group where basically they asked them to just kind of maintain their regular lifestyle and not change much. Now, before I show you the next slide, can anybody venture a guess on which group or groups you would guess had the most drop, or any drop, in their CTRA gene expression, which is, again, the gene that's associated with adversity? Anybody want to just take a guess?
Yeah, I'd like to take a guess.
Please.
Sure. I believe that actually all 3 of those would help with the CTR gene. I don't know which one would help the most, perhaps kindness to others or kindness to the world rather than kindness to self. But kindness to self is very important, I think, too, to keep along with the other 2.
And I actually agree. That was my thought when I was first reading through the study. That was exactly what I guessed. But does anyone else have another opinion before I reveal? Any takers? If not, I'll go ahead. So I was surprised because the only group that had a measurable difference, at least in 5 weeks, was the group that was performing acts of kindness to others. Now, one of the theories that the authors hypothesized was, right, when you do an act of kindness for others, it's a social act, right? You're getting some kind of an emotional reciprocation on some level, and that the theory is we were wired, right, to be part of a tribe, a village, a community, and so that was their hypothesis. Whereas, let's say kindness, acts of kindness for the world are important. I think they're very important, but it didn't create that same biological change. And same thing with acts of kindness for yourself. It just didn't create that kind of change with the CTRA gene expression, even though it may have other values, of course. Now, again, I wouldn't, let's say you're in the midst of chemo, you're probably going to need much more acts of kindness for yourself, because this wasn't looking at a group of people who was in the middle of chemo. So please don't misinterpret the relevance of this. But I think it does give us some insight, again, to what Frankl was talking about. Right? Remember, I'm going to go back a few slides to his theories on, what gives us meaning and purpose. And usually, and again, at least one of these bubbles was, caring for another, or doing, or you could even argue for many types of work, particularly if it's volunteer work, or your profession, if you're, if you're passionate about it, it's often in relationship to other people. The real reason I wanted to share the study, though, is to remind us it was just 5 weeks. And the CTRA gene is not set in stone, right? We're not just pre-programmed, and we do have still a sense of agency to change not only our outlook, but maybe our inner biology as well. And I think in the last couple minutes, I'm gonna stop in a few minutes. I have no intention of finishing all these slides. I just wanted to offer one other idea that I think is really important to mastering, or trying to master, the art of resilience. And that's really the art of having a sense of perspective. And I want to say at the onset, it's not about viewing the world through rose-tinted glasses and thinking, just being a Pollyanna about everything, and just say everything's perfect and there are no problems in the world and everything is just fine. There's an authentic way that one can have realistic hope and realistic optimism. Sean Aker, if he was at Harvard, his argument was that only 10% of our long-term happiness is based on the external world. In other words, our reality. Whereas most of it is really based on how we perceive the world. That's why that question, I think, is so important. Asking, what does life expect from me, changes the way we perceive the world compared to what do I expect from life. So the argument again is how we perceive our reality. Supposedly, the Buddha said the following: your worst enemies cannot harm you as much as your own thoughts unguarded. But once you master your thoughts, no one can help you as much, not even, in his words, your father or your mother. And that was one of Frankl's points as well, that, we have ownership on how we're going to respond. This is one of, I think, the most commonly cited passages from Man's Search for Meaning. He said, we who lived in concentration camps can remember the men who walked through the huts, comforting others, giving away their last piece of bread. They may have been few in number, but they offer sufficient proof that everything can be taken from a man but one thing, the last of the human freedoms, to choose one attitude in any given set of circumstances, to choose one's own way. And this really gets to, an element of what's known as cognitive behavioral therapy. I'm not a psychologist, but one of the ideas with cognitive behavioral therapy is, we have this situation, and then we tend to have like an automatic, emotional response to the situation, which many times may be a negative one. And the argument with cognitive behavioral therapy is, between the situation and the emotional response, there is a thought. And if we could learn to adapt that thought to a more empowering one, then the idea is that we can have a more resilient outlook. And so that's the idea behind this quote, is that between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. It's whether you view this as Frankl's work in what's called logotherapy, finding meaning, or cognitive behavioral therapy, which again is been incredibly well described by Beck, psychologist by the name of Beck. I think he passed away this last year. It is, I think, a really powerful tool. And I think that's what Frankl talks about with quotes like this. He said, when we are no longer able to change a situation, we are challenged to change ourselves. Just reminding us that, again, we have that sense of agency. Again, easier said than done. And another way, I think, just finishing off and wrapping up the perspective management piece as we wrap up, is I would argue thinking about a sense of legacy. And I know, as a society, and I'm being far too simplistic, as a society, we often spend much of our adulthood thinking about how to invest our money, right? And we live in a capitalistic world, which is just what it is, and it has its advantages and disadvantages, but that's what we think about. But capitalism alone won't teach us how to invest our time. And that's what legacy offers. And we all have, kind of come across, for example, leadership books or effective habit books, Stephen Covey and others, and they all talk about this idea that, we spend probably too much time on things that are urgent, like it's responding to texts and emails and paying bills and just things that are kind of important, maybe on the surface at that moment, but maybe not really important in the long run. And the idea of legacy in my mind is that if we remind ourselves, at least occasionally, nobody wants to be morbid about these things, but occasionally, that we're all mortal, that we all have only so much time. I hope it's a long time, for all of us, but at the end of the day, it's all limited. That it's only when we remind ourselves of that fact occasionally that we'll have the reminder to spend some time on things that are important but not urgent. And I think that is really the secret of this famous psalm. And of course, you may be familiar with this. It says, teach us to number our days that we may get a heart of gold. And to me, of course, what they're saying is, we have to remember that, again, we have limited time, right? Life is short. And only when we remember that life is short, again, are we going to have that sense of urgency on the important things, not just the things that are urgent in that moment. And I'm going to conclude with another, quote from Maya Angelou, who I think also beautifully speaks to this idea that, we're all creating a legacy. It's just we want to be more aware of it. The awareness is what seems to make a difference. And here's what Maya Angelou said. She said, you have no idea what your legacy will be. Your legacy is what you do every day. Your legacy is every life you've touched, every person whose life was either moved or not. It's every person you've harmed or helped. That's your legacy. So I think the idea is that, we're doing it anyway, right? We're creating a legacy anyway. Why not make it one that speaks to our most important values and wishes? And I think if we do that, at least occasionally, that's another one of those kind of gems for managing perspective, particularly when we're in a challenging situation. In closing, I'm gonna skip these slides. I just want to go to my last slide, which well, first off, again, I took these themes from our program that we call GRACE, which stands for Growing Resilience and Courage. Again, this is 11 or 12 hours, and I've tried to just share a couple highlights in 30 minutes, which I know doesn't do it much justice, but I at least wanted to offer some insight into what we do with that program. And I think, we know that these are not easy ideas, and it takes a lot of practice to sit with these ideas if we really want to be able to access them when we need them. And so practice really does make perfect with this. And I think this quote, if you haven't heard this, really speaks to this idea. It's from Wilfred Peterson, and it underlines the importance of practice in our thinking. He said, as a single footstep will not make a path on the earth, so a single thought will not make a pathway in the mind. To make a deep physical path, we must walk and walk again. To make a deep mental path, we must think again and again the kind of thoughts we wish to have dominate our lives. And if I had to summarize some of the pearls from my perspective on enhancing resiliency, it's meaning-centered living for the reasons that we talked about, mastering the art of perspective, which is oh so difficult. Gratitude, I didn't talk about much today, integrating a sense of legacy, the critical importance of staying connected, which we talk about more during the program, some kind of mindfulness or insight-oriented program in a way that makes sense for you. And again, humor is the best medicine. So somehow trying to keep a sense of humor in the midst of this is critically important. And Frankl actually talked about that in his work as well. I'm leaving my contact info if I could be helpful. We're actually starting a grace group, a full group in a couple of weeks. I don't know if there's space available. I could certainly check if anyone's interested. But I thank you all for your attention and joining us here, in the middle of the day on a random weekday. I'd be happy to take any questions, comments, concerns, if there are any. Thank you.
Thank you so much, Dr. Asher. I'm actually going to stop the recording just so that we can move to the gallery view, and then we can all engage in discussion.